Well, throughout the pandemic, there have been many reports of outbreaks in long-term care homes and retirement homes. These outbreaks have been reduced, however, there is still, it persists, and there's a lot of confusion about why some senior living settings have fared better than others. Sasha Zivkovic, Regional Community Relations Manager for Viva Retirement Communities, is joining us this morning. Good to have you with us.
Good morning, Bob. Thanks for having me.
Yeah, there's been a lot of shock and anger over when we hear of these COVID-19 outbreaks in long-term care and retirement residences, with our most vulnerable population still exposed to unvaccinated staff. Is there a deadline in place industry-wide to put an end to this?
Well, my understanding is that there is a deadline in place, and I know that each of the providers or each of the retirement providers are working diligently with our regulators to determine exactly how and when that will be rolled out and what that will look like.
Okay, but that will be mandatory vaccinations, no exceptions for staff members?
I'm not the actual professional person to ask about that question, but to my understanding, I know that they're definitely leaning in that direction, given what our industry has experienced thus far due to the COVID outbreak.
Now, retirement communities, there's a big difference, too, between long-term care and retirement communities. So what is the criteria? Let's talk about the level of care with retirement communities when people are thinking about the setting for their loved ones. What is appropriate? What's the level of care?
Yeah, so I mean, it's a really great question, Bob. And in fact, there are so many folks that really just don't understand the differences between long-term care and retirement. And some may say I spent a good chunk of my career trying to educate folks precisely on that. There are many, many differences from care to amenities. So for example, long-term care homes are focused a little bit more, or not a little bit more, primarily on healthcare and supporting activities of daily living. Whereas in retirement communities, we're focused a little bit more on providing an independent and engaging lifestyle. Of course, there are personalized wellness services that are available in retirement communities as well. But there are many differences as well in the bricks and mortar. So for example, in long-term care homes, suites or rooms look a lot more like a hospital, where you have a semi-private or a ward situation. And in situations as such, it's a lot easier to transmit COVID-19, whereas, for example, in retirement communities, suites look more like condominiums. And overall, Bob, amenity space is quite large. So with larger amenity spaces and more elevators, we're really able to abide by the 6 feet social distancing. And because of that, ultimately, retirement communities weren't impacted as tragically as many long-term care homes were. But it's also important to note that we also have to abide by public health protocols, including standards around infection prevention and control.
Are the services a la carte? Can you pay extra to get services just shy of long-term care? Like if people need, lifts, for example, or need that assistance, but don't really want to go to the long-term care at this point?
Absolutely, Bob, and I appreciate that question because many folks prefer not to have to move again. And so many retirement communities, including ours, are able to really support folks' care needs very, very far into or deep into some necessary care needs. So whether that be a two-person transfer, various different personalized services, but we are able to support folks, and families appreciate that because, as I said, once they move into retirement, we become part of their family, and they opt to stay with us and purchase in services to support folks.
Yeah, must be tough, of course, with COVID isolation. What kind of things do residents appreciate, and what are the most popular amenities?
Yeah. First and foremost, I mean, they appreciate having the family, so our team members, which are lovely, around and supporting them. But of course, they appreciate the many amenity spaces. So, for example, within our communities, we have this wonderful virtual golf simulator, which is very popular not only for our seniors, but for their families when they visit. But sorry.
Yeah, well, you know what? I'm sorry, Sasha, we do have to go, but you know what? We'll link up the Viva Retirement. You have a number of locations in the GTA, and we'll link up your website at chh.com so people can explore all those aforementioned amenities. Sasha Zivkovic, thanks so much for sharing this morning with us.
Thank you, Bob.
All right.
Have a great morning.
You too. Quick break. We're back with the news at 7:30.